Hey guys, welcome back to another educational lecture where we're going to go through Patella Tendinopathy, jumper's knee. Let's dive right in. So I thought a good place to start might be just defining what is a tendon exactly. So apologies if this is just really treading over old ground for you and you're more than aware of what a tendon is. But for those that don't, so here we've got the muscle and the bridge or the attachment point between the muscle and the bone is indeed the tendon. So it's a connective tissue structure, and we're actually going to go into quite a lot of detail as far as what the makeup, the physiological, anatomical makeup of the tendon is in just a second. But this is the essential, it's the bridge. The concept I want you to grasp hold of here is the bridge. And the muscle is the contractile element that is then contracting, it's producing force, it's transmitting that across that bridge, being the tendon, to the bone to produce movement. But what is going on when a healthy tendon becomes painful, and specifically the patella tendon? Now let's take a look at that now with a 3D anatomy view. All right, so let's take a look at the patella tendon, and you can see it right here. Let me highlight it for you. The patella tendon is essentially the extension, if we zoom out for a second here, of the quadriceps. So remember, the tendon is the aspect, that the connective tissue structure that attaches muscle to bone, and the bone in question here is the tibial tuberosity. So that's this aspect just here, as you can see, and this is where the force is transmitted through the muscle to the tendon, through the tendon, onto the bone to produce movement. And in this case, given that it's the quads, which, as we know, they extend or straighten the knee, that's what's going to be happen. That's the movement that's going to be produced. Whether that's in an isolated sense during a knee extension, leg extension on the machine in the gym, or when you're driving up from a jump, slam dunking, whatever floats your boat, jump squat, whatever it may be. You can see that given that the quadriceps, as the name suggests, is made up of 4 muscles. So one being the rectus femoris, that's the most superficial of the lot. Vastus lateralis is the one on the outside. The vastus medialis is on the inside. And there is actually one more if we peel back a layer here. There it is, hidden away. The vastus intermedius is the middle one, just underlying the rec fem. And all of these together converge into this kind of quadriceps tendon here up top, insert into the patella, the kneecap, and then into the patella tendon. Now, when it comes to tendon recovery, now when the tendon becomes painful, the pitfall I see most people fall into is that they treat it just as they would a muscular injury. And there are a lot of differences as far as how these two structures recover from an injury. What's the physiological process that they go through in response to an injury? So we look at muscles first. The injury is often sudden. And if you're wondering, you're trying to scratch your head thinking, oh, have I pulled a muscle or haven't I? If you can't pin that injury down to a specific mechanism, it's extremely unlikely that you've strained a muscle, because one of those, I would say, inherent factors in the history is that there's a clear mechanism. So you pull your hamstring, you pull your quad, calf, whatever it is it's coming on quickly and it's attached to a specific, when I say mechanism, I mean something you did, and typically that's something that either overly stretches that muscle suddenly, or it's a forcible contraction in a sudden moment. Anyway, so you got the point. Now, From that moment onwards, it triggers a typical inflammatory response. Depending on the extent of the injury, we generally get this kind of bleeding, inflammation, proliferation, which is kind of like the manufacturing process, the production of cells, both involved in that inflammatory process, and then restoring the sort of scar tissue, essentially kind of recreating new tissue. That's what I mean by fiber regeneration, and eventually we need to repair. Now, I just want to be very clear here is that there are definitely circumstances where tendon injuries can happen suddenly as well. And that might be in the sense of a tendon rupture would probably be the most obvious example of that. We're not talking about those types of injury here. We're talking about more of those gradual onset, those overuse type tendon issues, more chronic, where you're struggling to hang your hat on a specific thing that you've done rather than being a sudden onset. So you get this gradual onset of pain, and people often describe it as this sequence of, it starts off feeling sore at the beginning of activity, then it warms up and it goes away, then I'm okay, then it maybe comes back later, and it's gradually seeping more and more into your activity and becoming more and more prevalent and harder to settle down and more self-limiting. There's a continuum model, which is, I think, personally speaking, I think it's the best model, the best conceptual way to see in an actionable way. So you can look at this and go, right, I get it, and I get what I can do at each stage to try and improve things, to get me back on course and to restore things back to normal. So you can see we've got the normal tendon, normal healthy tendon, and then if we add in some various factors which we'll go through later, particularly if these are introduced suddenly, because tendons they're not good, they are adaptable, but they're not good at adapting to changes that are introduced very quickly. So if we have an excessive amount of these factors, spike in training often combined with other factors, we're going to descend down this continuum, and I'll go through each of these individually in detail. On the flip side of that, though, if we can give the tendon what it needs, spoiler alert, it's not complete rest, but it's rather optimizing the way we load it. We can go hop up on the green arrow here pathway and restore ourselves back to normal. So within the tendon, it's made up of predominantly the protein fibers called collagen. Now there's a few different types of collagen, which we'll go through in a second, but I want you to take a look at this organization, nice, neat, tightly bound bundles of this protein called collagen. And that's how things look in a normal healthy tendon. Now, I've explained what goes on in tendons a few different ways. I think the last analogy I used was with pirates. But this time, as if that wasn't random enough, I'm going to use spaghetti this time. So, nice organized bundles when that spaghetti is, as you can see, rather tightly kind of bound together. Nice, neatly aligned, tightly bound together. The hard spaghetti, the type 1 collagen. You can see it's obviously bathed in a fluid substance, which is the ground substance there. And tenocytes are essentially the cells that produce these elements within the tendon. In the reactive stage, so what is the reactive stage? Is essentially the short-term, the immediate response of a tendon when it's been exposed to a spike in unaccustomed use, typically. So one of the first factors that happens is you get this proliferation, I struggle to say that, which is essentially mass production of proteoglycans. Sorry, I couldn't resist adding the googly eyes. So the proteoglycans are cells that are hydrophilic, meaning that they draw water they attract water into the tendon, and the ones in particular, so we use that kind of analogy of the puffer fish, right? So they suddenly expand. We're not just getting an increased production of them, but the size of these particular cells. Aggrecan is a proteoglycan which is larger and imbibes water into the tendon. So we're getting increased number. So just imagine you're on the tube and it was relatively quiet, and then suddenly it's rush hour and it's just pandemonium. The tube is getting full of people, and the next thing you probably want to see here is that the spaghetti analogy is that now we're starting to have this almost flood effect. This is why the tendons get thicker, sometimes get swollen. It's not a typical inflammatory response, but it's essentially that increase in water content. And the flood, if you want to think of it this way, is sort of starting to seep into the gaps and spread apart these once nicely, tightly bound together fibers. So collagen fibers spread by the flood. And the pain, of course, now there's a lot of different elements that might explain the pain here, but one, to stick with this culinary analogy, is that we get some certain chemical ingredients, if you like, substance P, glutamate, the pain spices, if you will, that really stir things up and give you that painful sensation when it comes to this first stage of the process. If nothing changes and we continue to, if you cast your mind back to that red arrow going downwards on the tendon continuum model, if we continue to just use and abuse the tendon, things are going to go down in this direction from reactive to disrepair, where we once had the spaghetti type bundles, type 1 collagen, which is that more resilient type, the one that is better able to deal with what we call tensile loading. So that's just that type of stress that we typically use it for. It's going to start to change in its composition. So the tenocytes, which also have this kind of mass population increase, just like those proteoglycans do, the puffer fish, we start to, I usually refer to this as the body's suddenly starting to produce this poor quality spaghetti, in this case, this poor patchwork job. It's using types of collagen, type 3 is just inherently less resilient and therefore less able to deal with the loads that we're putting through the tendon. The other factor here, as far as the pain's concerned, is that we start to see within symptomatic or painful tendons the ingrowth, the emergence of these structures called neovessels. So the really fancy scientific term is it's neoangiogenesis, which is just a fancy way of saying that there's this kind of growth of these nerve vessels into the tendon. If you think of the spaghetti getting spread, and then these the ingrowth of these structures starts to, just like the water created the flood, spread the fibers apart. Now these vessels are starting to grow in the gaps. That's the best way I can explain it. And it seems to these particular vessels seem to, along with the quote unquote pain spices, seem to play a big role in tendon related pain. Now the degenerative stage here, again, if nothing changes, we keep going down that pathway. Some of these changes are just the same. So the type 3 collagen is just the same, the less resilient type. But also it comes back to this notion that we want stiff tendons, because those are the ones, like the thick elastic band, that have that ability to store and release energy and recoil well. They're efficient. Whereas the loose, piddly, stringy, thin elastic bands is what we're getting with this type of spaghetti if we keep moving down that process. So let's talk about what are some of the causes, I should say, or combination of causes. And the way I like to think about it is that the stage is set by a combination of extrinsic factors. In other words, generally the training, the type of training we're doing, how often we're doing it, how much we're doing within each session, where we're doing it. Are we doing this activity? I mean, for example, some of the variations might be that if we're running, an environmental difference might be, are we doing this on the treadmill? Are we doing it outside? Are we trail running? Are we going downhill? Are we going around a track, etc.? So that's extrinsic. Intrinsic: gender, age, hormones, biomechanics, flexibility, medical history, medications, these kind of things also play a big role. And together they set the stage. So if you have a combination of predisposition and training wise, typically the main type of loading that's going to be the most strenuous for the patellar tendon, or for tendons in general, is going to be this energy storage and release. So if for Achilles tendon, it would be running, and for patellar tendon, it's generally sort of jumping. That's why it's not a coincidence that basketball players, volleyball players tend to be the ones who develop patella tendinitis, patella tendinopathy. And equally with Achilles, it's not a coincidence that it tends to be runners, right? Proofs in the pudding. The intrinsic factors, as far as gender, seems to be a larger portion of males. Males tend to have tend to be more commonly affected than females with this. However, hormonal factors, we know that estrogen provides this protective shield as such in some ways to the tendons, and that it's not a coincidence when we hit that kind of peri-postmenopausal age range that we start to see an increase in the incidence of tendon-related issues. So it takes a combination of these factors, and I kind of refer to that as the gasoline, and then there might be a spike. Tendons are not good at dealing with a sudden spike, and it could be a sudden spike in a change in the loading environment. You've been running on a treadmill, you suddenly do downhill trail running. You do 3 sessions a week, so you've suddenly started 5 sessions a week, or you've been doing nothing and then you go to start doing 3 5Ks a week. There's maybe a bit more of an obvious example, but it's also not a coincidence that when we had a period offloaded, so when we've been off for a few weeks, holiday, Christmas period, and come January we jump back into it, that's also a very common history that we hear. So combination of these factors, the lit match being a sudden change in some of these factors, particularly the ones on the left in the red circle, and there you go. So when it comes to the types of loading, the most strenuous for tendons are this, we refer to it as the stretch shortening cycle, the energy storage and release, all fancy ways of saying the same thing, describing the same thing, which is essentially when you're using that tendon as an elastic band, when you're getting a sudden storage of energy. So let's say, take the example, if you're doing a jumping squat or a box jump, but you're rebounding, so you're plyoing it, you jump up, you land, and then like the floor's lava, you bounce straight back up again. That, you can see where it says plyometrics, that's what I'm talking about. So the faster the rate at which we load a tendon, and with that bounce, without any interruption or pause between, that's going to be your top end of how strenuous it is. Now remember, I'm saying strenuous specifically. Strenuous is not a synonym for bad or you shouldn't do it, because if we didn't avoid anything that was stressful, we'd all just shrivel away, shrivel up and be weaklings, right? So stress is not inherently harmful, but you just have to make sure that you're cognizant of the dosage and the types of stress that you're using so that you don't have any unintentional effects, i.e. pain, injury. At the other end, the slower the load of rate of loading, static contractions, isometrics, which is what you've noticed we start with in knee shield, is that we start the first couple of weeks with isometrics for this reason as well, is going to be at your least strenuous end for tendons. Then isotonics is in the middle, so that's just where we're moving slowly through a full range of motion, so doing the squat slowly up and down. Holding a squat would be isometrics, moving up and down the squat slowly, isotonics, bouncing, jumping squats, plyometrics. There you go. Now, when it comes to how do we use this information to in the most advantageous way? Well, again, like I said, underloading, if we're not doing anything, this is why people often, when they get tendon issues, they go, oh, I'm just going to rest, and I'll rest for an arbitrary amount of time, and then I'll just have a go again. The problem is that underloading comes with negative effects that people don't realize. It's not as if you don't use the tendon, then nothing bad happens. It's only going to be good stuff. Tendons always want to be loaded to in some way or another. That it's just that you have to change the type of loading when you're in pain or when you're injured, and that underloading it, especially chronically underloading it, is going to lead to less than ideal adaptations. It's going to get weaker, it's going to get less resilient. Its capacity to tolerate stress is going to reduce over time. Equally, non-sub activity obviously isn't ideal. And the prehab zone is when we're finding there's a principle within strength and conditioning, which is overload. In other words, you have to be, to some degree, overloading slightly above your current capacity in order to stimulate favorable adaptation change, improvements in how much, in this case, the tendon can tolerate. So, but notice I'm saying slightly, not significantly, because if we really breach above that sweet spot zone, then we're starting to stroll into injury territory. So I thought this might be a nice way to finish the presentation with this little visual of how we can use the information we've gone through. So to finish up the presentation, we're going to look at this concept of the scale, how to balance the loading with our capacity. And in the center of this table, this isn't mine. This was created by Dr. Andrea Spinner of Functional Range Conditioning, and I would highly recommend you check him out if you're unaware of his work already, because he's a real source of wisdom and knowledge. I've just slightly adjusted it so we can incorporate how we use prehab here, but essentially it just goes like this. When loading is greater than capacity, how much our tendon can tolerate, sooner or later it results in injury. In a clinical sense, when it comes to an injury, someone in pain, we have to be a little bit careful and cautious, or cognizant, I should say, of how we go about loading, obviously, when it comes to somebody in pain. But generally speaking, it's when load is equal to capacity or maybe slightly under. Prehab, however, is when we're in a state where we're not actively injured, but we're looking to build our capacity, build our tissue tolerance, increase the robustness, the resilience of our tendons, in this case, patella tendon, so that they can better withstand the stresses of the activities that we do. And so that's where your prevention comes into play. When you develop a tendon that's capacity is greater than any stress you put through it, that's your prevention, that's your development of the knee shield. So on the two sides of the scale, we're having to be intelligent in our programming, in our structuring, in our periodization of our training with respect to these factors here. And when it comes to eliminating preventable contributory causes of injury, such as reduced flexibility, reduced ankle mobility, strength through the quadriceps, particularly with patella tendinopathy, our bar mechanics and our landing mechanics, etc. Those are the things we want to develop, and that's exactly what you're doing with the Knee Shield program. So thanks for tuning in again, guys, and look forward to seeing you in the next one.